Good morning, Susie. I'm Jessica. How are you feeling today? I understand you are nervous, so we're going to use this time to discuss the plan and approach all questions or concerns you may have. I want you to be prepared and know that we are a team during the whole process. The purpose of Mohs surgery is to complete the procedure in stages, as well as finish the process in one doctor's visit. Our goal is to leave limited scarring and remove the cancerous tumor from the top layer of the skin of your face with as little pain as possible. Additionally, these results will allow us to examine the whole tumor and leave healthy tissue without unnecessary damage. Basal cell carcinoma is a kind of skin cancer that starts in the basal cells and is positioned in the subterranean, which is the lower layer of the skin. These tumors typically grow slowly and do not spread. Skin cancer in general happens when there is an abnormal growth caused by skin cells that mutate into these growths on the skin. A dermatologist surgeon will perform the procedure to remove the malignant carcinoma. First, the surgeon will examine the spot and possibly mark the area if needed. Then he or she will inject local anesthesia to numb the area. Using a scalpel, the first thin layer of the carcinoma will be removed, and the tissue will be sent to pathology for lab results. While waiting for the results, the surgeon will bandage up the macule or nevus. Meanwhile, the surgeon will dissect the tissue, inject dyes, and map out the surgical site. Then the mass is frozen and cut into thin layers for observation with a telescope. If carcinoma cells are present, the surgeon will proceed to the removal of another layer in the exact area where the cells are found during the mapping of the tissue. This process continues until all malignant cells are removed from the epidermis. Depending on the size of the site, the surgeon will either stitch it up or leave it open to heal. Some rare situations may cause another specialized surgeon to perform a skin graft or a skin flap. It is essential to be patient during the process of Mohs surgery because it may take several hours. However, this depends on how many layers are removed. Additionally, since the method is extremely exact, it can produce a higher cure rate, can save healthier tissue, and create less scarring with the precision of the procedure. Even though the surgery is highly successful, there's still a risk of scarring. It is essential to follow the steps your doctor provides to you when it comes to caring for the wound. This may include changing your bandage and applying ointment to the area, as well as following the timeline for resuming daily habits or activities. Additionally, follow up with your doctor as directed to monitor the healing and remove stitches. You may experience arrhythmia or inflammation, however, only temporarily. The goal is to limit scarring, avoid keloids, and limit further surgeries. When you first obtain the basal cell carcinoma, you are now more prone to skin cancer, which means long-term care is critical. The surgeon may require appointments that will extend many years into the future. Your first visit will be necessary to remove stitches 5 to 7 days following the procedure. Thank you. If you have any more questions, please feel free to ask.